Let us discuss today about the various complement disorders. So before explaining those complement disorders in detail, I want to say that the complement disorder occurs mainly two ways. The complement disorder occur due to complement protein deficiencies. There are various complement proteins like C1 to C9. So if there is deficiency of those protein, then there could be the complement protein deficiency, and another is that if there is complement regulatory protein deficiency, then it occurs the complement disorders. So first of all, let us discuss about the complement protein deficiency. So in the complement protein deficiency, there are two types of complement protein deficiency. One is early complement deficiency, that are C1 to C4 deficiency, and another is terminal complement deficiency, that are C5 to C9. So in early complement deficiency, what happens is that there is deficiency of C1, complement protein 1, complement protein 2, complement protein 3, and complement protein 4. So if there is early complement deficiencies disorder, then there is the increased risk of severe or recurrent pyogenic sinus and respiratory tract infection. Also, there is increased risk of SLE in the early complement deficiency. Now let us discuss about a terminal complement deficiency. In the terminal complement deficiency, there is deficiency of complement protein 5, complement protein 6, complement protein 7, complement protein 8, and complement protein 9. In this type of terminal complement deficiency, there is increased susceptibility to recurrent Neisseria bacteremia. So if there is a patient presents with the recurrent Neisseria bacteremia, then you should suspect the terminal complement deficiency. And another complement disorder is complement regulatory protein deficiency. So in this complement protein regulatory deficiency, there is C1 esterase inhibitor deficiency. In this C1 esterase deficiency inhibitor, there's occur what happens is that it causes the hereditary angioedema. So what happens in the C1 esterase inhibitor deficiency is that there is unregulated activation of the kallikrein, which leads to increased amount of the bradykinin, and there is characterized by the decreased in C4 levels. So in this type of patient where there is C1 esterase inhibitor deficiency, then you should avoid using the ACE inhibitors. So the ACE inhibitors are contraindicated in those type of patient where there is C1 esterase inhibitor deficiency, because ACE inhibitors generally increases the bradykinin. So if there is the use of ACE inhibitor in the C1 esterase inhibitor deficiency patient, then would be remarkable increase in the bradykinin. So the symptoms would be the marked in the C1 esterase deficiency patient when there is the when we use ACE inhibitors in those type of patient. And another is paroxysmal nocturnal hemoglobinuria. So what happens in the PNS, paroxysmal nocturnal hemoglobinuria? There is defect in the PIGA gene, so it forms the formation of the GPI. So what happens is that the GPI is the protein that anchors for the complement inhibitors. The various complement inhibitors in our body are DAF, that is CD55, and YAMI-RL, that is also known as CD59. So these are the complement inhibitors. So GPI is the glycophosphatidylinositol, and whereas the DAF is the decay accelerating factor, and the YAMI-RL is the membrane inhibitor of the reactive lysis. So after where there is the prevention of the formation of the GPI, there what happens, there is the complement mediated intravascular hemolysis, which leads to the decrease of the haptoglobin. So in the paroxysmal nocturnal hemoglobinuria, there is defect in PIGA gene, which will ultimately leads to decrease in haptoglobin. So the clinical features in those type of patients who have paroxysmal nocturnal hemoglobinuria will have the dark color urine. So in this topic we discuss about the various complement disorder. You have to know that there are mainly two types of complement disorder. One is complement protein deficiency that causes the complement disorder. Another is the complement regulatory protein deficiency. In the complement protein deficiency, there is early complement deficiency and the terminal complement deficiency, whereas in the complement regulatory protein deficiency, there is the C1 esterase inhibitor deficiency and paroxysmal nocturnal hemoglobinuria. So I hope you understood this topic on the complement disorder. Thank you.